Hi, are you curious about chiropractic? Are you curious if we treat the same day, how many visits it will take to get you better, what to expect after your first treatment? Then this video is for you. I'm Dr. Karin Drummond, owner of Drummond Chiropractic, and I'm going to share with you what to expect when you see a chiropractor. So when you first come, we'll do a history and physical to determine if we can do a treatment the very same day. Most people we do, but if we're worried about things like fractures or tumors or other organic causes of your pain, we might have to do some further diagnostic tests and some images. But again, this is very rare. So again, we will likely treat in the first visit. So what can happen after your first treatment? Well, one of three things are going to happen. One is either you're going to feel better right away. We love those one visit wonders. Now the question is, will that relief last? So we'll still have to do a follow-up treatment. Another thing that can happen is that you feel no relief from your pain. Well, then we'll look at other things as markers, like maybe your range of motion will be better. Another thing that can happen is maybe your pain might feel worse. So this can still be an indication that you're getting better, because if your pain is from a pinched nerve and we take that pressure off the nerve, all of a sudden it's going to be able to communicate that pain to your brain, and then you're going to feel more pain but actually be better. So the way to tell if an increase in pain is actually a good sign is if the pain is more centralized in a smaller area, because the nerve is more accurately communicating to the brain what's going on. If there's a reduction in nerve signs like reduced numbness, tingling, weakness, these are all signs of improvement. And again, other markers like increased range of motion. Now, if for some reason your pain is an indication that you are worsening, then we'll do more exams and images to find out exactly why you aren't responding as we expected. So how many visits is it going to take for you to be better? Well, again, this depends on your condition, on your age, and other lifestyle factors. Here at Drummond Chiropractic, we are known for not doing standard treatment plans. We cater the treatment needs for your specific condition and how well you're responding to the treatments. So after the first visit, we typically want to see you within a couple days to see if you did get better, the same, or worse. And then after the second visit, if you are getting better and you're feeling better than when you even left in the last visit, then we'll start spacing out the visits. We'll go to 4 days, and if you're holding well, we'll go to a week, and if you're holding well, we'll go a couple weeks. If you're holding well, we'll go a month. We'll get to that point where you're getting to the point where you're not holding the treatments as well and you're starting to regress, and then we know how many visits you need to keep your condition staying well. So we'll use an example of somebody coming with a stiff neck. They get an adjustment. The next time they come in, not only they're feeling better, but they have full range of motion. Well, then we'll do a follow-up in a week to make sure it stayed well. And if it does, then maybe we'll do a follow-up in a couple weeks, and then again in a month. And at that point, if they're feeling well enough, we can release them from care. Or a more complicated case where they have a disc herniation. It might take 6 visits to get them to where they're holding their treatments, and then we start spacing them from care, and then they get to the point where they come in after a week, and then 2 weeks, and then a month. But at a month, they start seeing the signs that their spine is starting to compress again, and they might need monthly visits for a period of time. So I hope this has been helpful in helping you understand how many treatments it's going to take, what to expect after your first visit. And if you have any questions, feel free to post them below. And until next time, stay well.